For many Kenyan families, the story of cancer has become the greatest health scare. One that upon news of positive diagnosis has become synonymous with financial strain. But for cancer patients, the pain of seeking for treatment, long queues at public health facilities, and the fear of the future is even more excruciating. That only 2 public facilities in the country offer radiotherapy services does not help. But Nakuru Provincial General Hospital is in the process of putting up a radiotherapy center to boost its cancer treatment facility. That is now just over 15 months since it opened its doors. Sam Gituku spent an afternoon at the facility and tells us the story of hope hinged on devolution.
Many cancer patients have told a story of initial symptoms that were misdiagnosed by local health facilities, of drugs administered without much of success to healing. And ultimately, when the big news is broken, it's a moment of shock, disbelief and mixed emotion. But some, like Patricia Wangari, have been lucky.
I noticed a scar just right below my breast, and I got worried because it was producing some pus. And I came here to PGH. I went through ultrasound, and then I did a CT scan, FNA, and finally I went for core biopsy in Naivasha. And that is when I was told I had cancer.
Her diagnosis was in June 2019. She was in stage 2 of the disease. Nakuru Level 5 Hospital had been running the oncology center for 1 year. It's been 4 months of treatment that includes chemotherapy for Patricia. We found her in the middle of a session.
This is my 7th session. Na zile za kwanza za the first 4 kwa sababu iko na phase ya kwanza na ya pili. Hizo ndio zilikuwa na challenges. Ukiwekwa dawa unakuwa nauseated, saa zingine unatapika, unahara. It is been a challenge, lakini the second phase ya kuanzia 5, 6 na now 7 haijakuwa na challenge. Hata nimekuwa nikienda kazini vizuri.
The cancer facility at Nakuru's oldest public hospital was a response to a need.
Previously, we used to send our patients in far-off centers. We could send our patients to Kenyan National Hospital or MTRH, which were the only centers in the public sector. We have registered about 30,000 visits and revisits. We have been able to put about 600 patients on chemotherapy treatment. All these patients would be going outside this facility and this county and this region to seek for services somewhere else, and that comes with a cost.
With over 47,000 new cancer cases reported every year in Kenya, the pressure is mounting on the counties, most of which have no functional cancer treatment facilities. It took innovation for Nakuru to break the barrier.
We spent quite an amount of money, more than 15 million shillings, and we did not have to construct a new building. It was just renovation and making the changes so that at least we could start the services.
A consultancy was hired, bringing together a cancer specialist doctor, an oncology nurse, a pharmaceutical technologist, and other professionals. But the cost of maintenance is regular. The facility can attend to 13 chemo sessions a day, serving both children and adults.
To continue running the services, you have to keep on investing. We buy commodities worth about 3 million every month. 3 million shillings is spent on buying drugs, gloves, and other things that goes into this service. Then we invest on other commodities, the ones that will go into screening and other services that have to be there to make sure that we have a comprehensive oncology center.
Back at the procedure room, Patricia is done with her chemotherapy session. Looking upbeat about life, she needs to fill NHIF forms for authorization of her next chemo that she hopes will be her last.
Most of the time you get that NHIF does not cover 100%, as they usually tell us in public institutions they're supposed to cover for 100%. So you get most of the time that the patients will have to do top-ups because the drugs are quite expensive, and if we say that since NHIF has covered this amount of money we are going to waiver the rest, the department will not be there.
That's where most of our patients get a challenge. For instance, an original molecule of Herceptin cost a staggering 91,000. Now you can imagine NHF does not pay for all the cycles. And a patient is supposed to complete up to 18 cycles.
As she walks out, a young man is offering instructions. We learn that he is a cancer survivor, now working at the hospital.
Nilikuwa mgonjwa, nilikuwa na joto, na sweat, a lot of vomiting from January to kitu October. Lakini sikuwa najua naugua nini kwa sababu sikuwa nimeenda hizo test ama screening. So nilikuwa naenda kwa private doctors, naenda clinics, natibiwa vitu ambavyo havipo.
Ndungu is a former street boy. Fortunes changed by a donor who saw him through school. By the time he fell ill, the donor had left.
November tarehe 11 hivi tukapanga na nikafanywa surgery at Annex Hospital. Ule uvimbo ukatolewa, which it was 271 grams. Hiyo ni kama nyama nusu, quarter.
Biopsy of the flesh returned with testicular cancer. Nakuru PGH was going to be a regular destination.
So I used to come alone for chemo sessions and I used to go alone. Na bado nilikuwa naishi kwa mtu wakati ule. Nikafanya 6 sessions nikamaliza. By April nikatuma Nairobi for radiotherapy at Nairobi Hospital. Nikafanya 21 sessions. And today I'm a survivor.
Though the effects of chemotherapy and radiotherapy were tormenting, Ibrahim sees his cancer story as his life's turning point. His medication partly paid for by the same doctors that attended to him.
Maisha yangu yalikuwa magumu hata kabla mimi sijakuwa mgonjwa. Na nafikiria kwamba wakati mwingine Mungu akitaka kukubariki, anatumia njia tofauti sana kukuinua na kubadilisha maisha yako. So according to me, God used cancer to change my life.
He now has a job at the hospital, managing to pay for his NHIF contributions and keep his life running. Nakuru PGH has become the hope of residents and even those from nearby counties. But a gap still exists that they have to send patients to Nairobi for radiotherapy sessions. The situation provoking innovation.
At the moment, we have hired or rented a house in Nairobi because radiotherapy treatment is a lengthy treatment where you have to stay for like 6 weeks. So at the moment, we are paying for a house somewhere in Nairobi where our patients are housed.
I think with the onset of devolution, we are supposed to devolve these oncology services to the counties. The numbers that are going to Kenyatta are too many. And as we are aware, cancer is a disease that progresses very fast. And because of the delays that are sometimes experienced in Kenyatta, the disease is able to progress.
The hospital is now putting up a radiotherapy facility in the compound. The design and implementation highly regulated given the sensitivity of the treatment procedure. We are told the bunker's exterior walls will have the thickness of 1.6 meters of concrete, though the inner pillar will be 2.2 meters thick and the foundation will be 550 cubic meters of concrete. Built so to avoid radiation from escaping into the environment. It is a costly affair funded by the county and the national government, but essential for current and future cancer patients.
As you're aware, it's just Kenyatta and Eldoret, MTRH. And for that the one in MTRH has not started operating, that are able to offer radiotherapy services. The next county will be Nakuru. The process of constructing the radiotherapy bunker is undergoing. It should be operational in the next few months.
The structure behind me is expected to cost up to $500 million shillings and will be ready by mid next year. It will be housing 2 radiotherapy machines, taking this hospital a step further in addressing the scourge that is cancer. Sami Kituko, Citizen TV, Nakuru Level 5 Hospital.